There was a great line, for those of you who are in Houston, there was a great line that T. Boone Pickens had that was referenced during that conversation. If you're tending elephants, don't get distracted by rabbits. And it's a great reminder because I think we have a whole lot of rabbits right now that we're trying to keep on the periphery while we focus on the big tasks at hand. With that in mind, I want to introduce the first of three dignitaries that we have. The Honourable Matt Jones currently serves as Alberta's Minister of Hospital and Surgical Health Services. Minister Jones brings a wealth of experience, having previously served as Minister of Jobs, Economy and Trade, Affordability and Utilities, and the Minister of Children's Services. Before entering public service as an elected official, Minister Jones worked in investment banking, supporting Alberta businesses. This may be his first speech, new on the job, so please go easy on him.
Good morning. Oh, there's more people in this room than I thought. I can confirm that I do not have a PhD, and the longer I spend in this room, the more apparent that will become. But you can also look at it another way. I mean, I'm up here for some reason, so that Bachelor of Commerce from the University of Calgary, it's working. Thanks, Ed. Thank you for that introduction. On behalf of the Government of Alberta and all Albertans, I welcome you to Calgary. I am a representative for a local Calgary riding here. So welcome to the G7 Canada Brain Economy Summit. And I'd like to start by acknowledging the leadership of the Hotchkiss Brain Institute for initiating and hosting this important summit. Your efforts to bring together system partners from across Alberta, the United States, and Canada, and around the world reflect a deep commitment to collaboration, innovation, and the advancement of brain health. I also want to thank all participants for bringing your expertise to Alberta. This summit presents an opportunity to exchange best practices, strengthen global partnerships, and improve patient and economic outcomes here at home and around the world. I'm excited to be here to learn about the importance of the brain economy and how treating brain health as a critical asset can shape Alberta's economic and social future. Brain health does impact every stage of life, from childhood development to healthy aging, and is essential for productivity, innovation, and our overall well-being. Investing in brain health means investing in our workforce, our communities, and our capacity to thrive in a knowledge-based economy. By prioritizing prevention, early intervention, and research, we can improve outcomes and reduce the strain on our healthcare system. That's why institutions like the HBI are so important. They drive innovation, advance critical research, and help turn knowledge into real-world improvements in brain health care and beyond. The HBI positions Alberta to lead the way in understanding how our brain capital fuels our economy, builds resilience, and empowers us to face the future with confidence and optimism. The Institute's highly specialized work is focused on keeping brains healthy, whether through prevention or treatment, or repairing damage caused by concussions or chronic conditions, or serving as a hub for leading-edge mental health research. Just as the Hotchkiss is devoted to pursuing innovative pathways and partnerships for better health, so too is our government. Over the past 18 months, our government has achieved significant milestones in our work to refocus Alberta's healthcare system. 4 new provincial health agencies have been established, each focused on a core component of Alberta's healthcare system. Primary Care Alberta, which will ensure that every Albertan has access to high-quality primary care no matter where they live. Acute Care Alberta, which will be responsible for overseeing critical and emergency care across the province, with a strong focus on reducing wait times in emergency departments and for surgeries. Assisted Living Alberta, set to be operational this fall, will provide a comprehensive system of continuing and supportive care for our aging population, along with wraparound services for vulnerable Albertans. And Recovery Alberta, dedicated to delivering mental health and addiction services, helping Albertans access the care they need to achieve lasting recovery. A great deal of work has gone into our refocusing efforts, and we believe this will not only ensure Albertans get the health care they need, it will also create the leadership and support necessary to advance groundbreaking health research like the work being done by many of those in this room. So thank you for your contributions. I wish you a productive and engaging day of discussion and every success as you continue advancing this important work and capitalizing on the brain economy. Thank you.
Our second dignitary to speak today is Senator Katherine Hay. Senator Hay is an executive with over 40 years of experience in academia, healthcare, mental health, digital solutions, innovation, data and technology, and global collaboration. In March 2025, Senator Hay was appointed to the Senate of Canada with a strong commitment of mandates of digital health and virtual care and e-solutions innovation and data leadership, youth empowerment, youth mental health, and human rights. In 2017, Ms. Hay began her role as President and Chief Executive Officer of Kids Help Phone, transforming the organization into Canada's only national 24/7 multilingual e-mental health service for young people. KHP has become an innovation data-driven technology charity with a laser-sharp focus on youth and mental health, launching nationally and globally in 2025. Please help me welcome Senator Hay.
Appreciate it. Thanks a lot. Thank you. Well, hello, everyone. Good morning. I think we are remiss in not saying that we are also in the epicenter of the Edmonton Oilers and Team Canada. So welcome. I'm super glad to be here. I feel honored. Outside of my Edmonton Oiler hat, I do wear two hats today, as mentioned. First, and I feel humbled and enormous accountability to wear these hats. First, I'm accountable to the young people in Canada, coast to coast to coast, as a president and co-CEO, because I'm retired designate, soon to retire, of KHP, and as noted, the only 24/7 e-mental health solution for young people in the country. I steward and cherish their trust in KHP and what they share to us or with us through all our digital services. And I do have to thank the province of Alberta for the incredible support over the years, certainly since the beginning of the pandemic. You've been relentless supporting KHP and youth and digital solutions for Albertan youth. Second, I work for all the people of Canada as a senator in the Senate of Canada. I have no political affiliation. In fact, my political party is the people of Canada. And I'm here today because the mental health of young people, families, and communities is not merely a public health issue that we worry about, that we talk about, and we react to. It is the cornerstone, the very foundation to our future, all our futures in every country. We need to have an action plan. We need an actionable, viable strategy. And now I'm going to get on a soapbox, so fair warning. We need to make a brain economy, the brain economy, a top economic priority. Because today, the deterioration of brain health is a very real, critical economic challenge. Today, not tomorrow, today. And we as G7 nations, or any nation, as we quest for greater happiness and well-being and greater economic leadership and growth, we need to quest for and lead the brain economy first. And in my opinion, humble as it might not sound right now, we need to start with the very people that will drive all our future, which is our young people. Let me take you back a few years. Like not centuries or decades, just to 2019. And I'm going to give you a little bit of context that you heard. Kids Help Phone is essentially an innovation, data-driven technology company that also happens to be a youth mental health charity. I say that because KHP has the largest data set on youth and mental health in Canada. And it is 52 million data points in our data set. And it's very unusual. It's real time, real language, real geography. We know what young people are struggling with and worrying about as recently as yesterday, because they spoke with us yesterday. And we build products and services using AI and machine learning and various digital solutions to meet young people where they are. So there's some context. The journey I'm going to take you on now will maybe stagger you, probably not, because you all are very informed on this, and perhaps give you some hope. So in 2019, KHP saw a 30% uptick in young people reaching out to Kids Help Phone from the year before, 30%. If I was a for-profit, that would be a good bonus year, but 30% uptick in youth and mental health in 2019. Because of the way we're set up with innovation and scalability, we were able to meet and expand for that. At the time, and Val Taylor will remember this specifically, we raised the proverbial red flag loudly that year. I said directly to the Prime Minister and the Premier of Alberta that we have a mental health crisis in play. More than 1.9 million interactions in 2019. That was a big deal. And then COVID. When the world shut down and Canada shut down, KHP did not shut down. We scaled and scaled and scaled again. And here is where the hope truly lies, silver linings. Since March 2020, KHP has interacted with young people from about 5 to 28 in every corner of the country more than 22.5 million times. That's averaging about 4.5 million per year in interactions. The silver lining here, folks, is that they are reaching out. The young people are showing courage, resiliency, and help-seeking behavior. That is good. Yet, what they are reaching out about is sobering. The acuity is higher than it has ever been. Now what I say to anyone who will listen to me, and I'm tenacious, including a Prime Minister, is we don't have a mental health crisis in play. What we have is a mental health crisis embedded everywhere. Mental health challenges are now the #1 issue for youth. Depression, anxiety, suicide ideation, relationship issues, bullying, cyber anxiety. Suicide is the second leading cause of death for young people in Canada aged 15 to 24. I find that appalling. Canada lays claim to the 5th highest youth suicide rate in the industrialized world. Canada does. And distressingly, very distressingly, the number of children aged 13 and under who've reached out to Kids Help Phone, and remember our numbers, they're big numbers, under 13 reaching out to Kids Help Phone about suicide and suicide ideation has doubled in the last 4 years. So let's take those staggering statistics and lay it out on some impact. That one tragic suicide directly impacts approximately 120 people. Devastating loss, community loss, productivity loss, well-being loss. You can just feel and see that ripple effect. That is not a healthy brain economy. And respectfully, and I believe it was said earlier, to the amazing and way smarter people than me, the researchers here, and I share a bachelor in various things, psychology being one, but no PhD here. You may say that 1 in 5 young people in Canada experience a mental health issue or disorder, and I respectfully disagree with that. I think it is 1 in 1, if not directly, through friends, family, colleagues, classmates, siblings. Just we came through the pandemic. Take a look at the world today. It's relentless. So doesn't that make impact to mental health a real 1 in 1 issue? So let me get back to young people. Only 35% of young people who need mental health treatment are able to access professional help with long wait times. And you likely all know this, 70% of mental health that manifests in adults began or was rooted in their youth, 70%. And that is being played out directly in our economy today. Insurance and EAP companies will tell you that mental health and mental illness account for 30% of their disability claims, yet account for 70% of their costs. That is a staggering economic signal and not a good one. And that just speaks to those who have EAPs. Imagine the many that do not have. And let me say just a couple more things, controversial or not. There is no equity in healthcare, let alone mental health care, not for First Nation, Métis, Inuit young people, not for Black, African, Caribbean young people, not for newcomers and refugees, for young people in rural Canada, for young people in urban Canada, for 2S LGBTQ+ young people. Most definitely equity seeking and equity deserving, but not equity, it's a fact. Put this all together and it's pretty clear why the brain economy needs to be a top economic priority for every G7 leader. We need more than reactionary care and capacity building, Band-Aids, and dare I say, more podium announcements. What we need is a bold and actionable strategy, a real investment with accountability to that investment. Every day we delay is a day we lose talent, potential, and hope, and lives. But the good news, because we have to lean against silver lining, is that there is strong foundation to build from. You just have to look in this room. Canada has a strong foundation. Many, many countries do. And so we're here to build off those foundations together. My mantra, if you haven't figured it out by now, is investing in youth mental health isn't just the right thing to do. It's the smart economic thing to do. It's how we will build brain economy for the future. So to the young people of Canada, because I have to speak to them, I work for them, your courage and your honesty and resilience continue to inspire me. It should inspire all of you. You've trusted us at KHP with your stories and your fears and your hopes and your strengths, so we're not going to let you down. And to the policymakers and funders and leaders across this country and to the G7 leaders, now is the time to act. If we're serious about building a thriving brain economy, we must be serious about investing in it. Without it, economic progress is really just an illusion. And here's what I know to be true. There is no health without mental health. And what I also know to be true is there's no sustainable, healthy economy without a thriving and healthy brain economy. So today, it's beautiful, it's sunny, we're in a great country, we're in a great city, and we're together to build for the future. Today, we'll put a stake in the ground, we'll draw a line in the sand, and put a very clear call to action out. So merci, thank you, miigwech.